Hello everyone, we have Dr. Sameeta here. She is a pediatric neurologist at Rainbow Children's Hospital. Let's learn more about ADHD today with her. Doctor, what is ADHD?
Hi Dr. Shilpa Shri, thank you for having me here. So ADHD is a neurodevelopmental condition with which a child is born. As the name suggests, it basically the child has issues with attention or focus and also may or may not have hyperactivity issues.
So is it a congenital disorder where the baby is born with this, or is it a developmental?
Absolutely. This is a condition a child is born with. It's not the environment or bad parenting or screen time, etc. which contribute. Rather, the child is born with it.
Okay. Dr. Sameeta, so what are the alarming symptoms in a child so that the parents can bring them to you?
Okay, so like I mentioned, ADHD has two components. The first part of it is when the child has difficulty in focusing. So when a parent comes to you saying that they have taught the child everything, but the child is not able to focus and study, even though he or she is really, trying their best to study, but they're not able to perform in school because they're not able to focus. They get very easily distracted. Secondly, they may be very hyperactive. That is, it is very difficult for them to stay in one place. Even after being told repeatedly to sit in a place, they find it very difficult, even in settings where they're supposed to sit, like for instance at school or say in a place of worship like a temple where they're supposed to be sitting. They find it very difficult, so they move around a lot.
Is it really a very common disorder? I see most of the children are very active, or we can say hyperactive nowadays.
Yes, so it is very, very common, but unfortunately many a times it is self-diagnosed or wrongly diagnosed. Sometimes it is over-diagnosed where a child does not have ADHD but may be called ADHD, and sometimes it is under-diagnosed where they say that it is only bad behavior, it is not ADHD. So it is very important for us to understand whether the child in fact has ADHD.
How do you do that, doctor?
Okay, so that's a very good question. So first thing is that, like I mentioned, these characteristics, that is the issues with focus as well as the hyperactivity, should be in two or more settings, which means the child should have the same problems in school, at home and outside and other places too. If they have it only at home, for instance, and otherwise in school they're very good, it just means that the environment at home is contributing to their behavior. Secondly, it affects the child's performance in school. So if because of the focus issues or the hyperactivity, they're unable to sit and perform or study their lessons, and they're not able to, achieve, even though they seem intelligent, they're not able to really, get in the good marks in school. That is also another indicator that it could just be ADHD.
Is there any specific test by which you tell that this particular child is having ADHD?
Yes, there are tests. Of course, they're not like blood tests or scans. Here, there is an assessment done in which a child is given age-appropriate activities and they're observed by a group of psychologists and doctors. And we see how the child performs it, how much focus the child has, and how he or she is able to perform it. Based on that, we score the child, and then we make a diagnosis of ADHD.
So we can completely treat the ADHD in a child?
Absolutely. It is very much manageable, maybe not completely treated or cured, but definitely very much manageable. It is important to know that ADHD is not only a disorder of childhood, it can go on to adulthood. So that is why it is important we catch it at a very early age and we manage it. And how we manage it is with the help of therapies, that is cognitive behavioral therapy, as well as in some cases even medications play a very important role.
Okay. And does ADHD really affect the life of a person when diagnosed?
Yes, if not treated, it does. Okay, but if it is managed well with medications and therapy, then they do extremely well. They go on to do absolutely fine like any other individual.
So how long does it take to treat a patient of ADHD?
So that's a very tricky question because it depends upon the child, the environment, the amount of treatment that is going on. So it's a very individualized answer. So it is very difficult to answer that. Some children, grow out of it in a very short period of time, or it's manageable in a short period of time. Some people might require lifelong support.
Okay. Thank you, Dr. Sameeta. It was a wonderful session.